Коллеги, я думаю, мы потихоньку можем начать. Еще один коллега сейчас присоединяется. Я думаю, он присоединится и уже практически...
So colleagues, we can go ahead and start. We're waiting for one more person who's supposed to join us now. So then I'll go ahead and start. I will turn on my video. Well, first of all, I would like to greet all of you on this online discussion of the issues, the results, on the activities of the work carried out at the regional level in the Eastern Europe and Central Asia on collaboration between law enforcement and public health. We'll probably say the police. I'd like to note some technical moments. First of all, I can see that everybody's microphone is turned off. The microphone is supposed to be turned on when we talk, so please don't forget it. Only me and the interpreter have a microphone turned on, who's interpreting our conversation into Russian. We have a Russian and English channel. On the Russian channel, supposed to stay those who speak Russian, and on the English channel, supposed to be those who speak Russian. And secondly, those who want to say something after my speech, please raise your hands through the mechanism of reaction. There's a button can be activated, and I will know that you are raising your hands. After you finish, please. And then everyone's supposed to stay on the channel where the language he speaks, and then the discussion will finish according to the plan. Then I'd like to show our today's agenda, who will speak, and as you can see, I'm a moderator today. Erkin is presenting the information on, let's say, the activities of the organization directed on collaboration between law enforcement and public health. Our discussion will be around this information. Then we'll have a comments on the questions and discussion. Before I give a word to Erkin, I would like to say a few words. At the beginning of this year, the regional work on the collecting of information on positive examples of collaboration between law enforcement and public health The Fund of Open Society works in both directions. This project included big regions, the region of the African countries, the region of South Asia countries, the region of North America, and there was implemented work on the research and collecting of information, how the collaboration between law enforcement and public health have been done, positive and negative examples of this work. And Erkin was a part of this team who carried out a work on the regions of Betsa and Eastern and Central Asia. The epidemic in many countries, COVID-19, the whole job was built online, was carried out online. And considering the work was done for 7 months, and today the discussion on what kind of work could be done, what can be changed, and what we have already done. Your comments, especially those who here first time, we would like to see new approaches, new directions, new aspects. The next year we'll be planning our work. And here I would like to note from the Russian-speaking participants, we have invited our colleagues who are engaged in building of constructive work between law enforcement and public health. Of course, we have lawyers, academics. Gulzat today is representing the organization that works on collaboration between law enforcement and public health, providing services to key groups like drug users, sex workers, and so on. She also represents the issues, and also there are lawyers. There is a lawyer who works with the vulnerable groups. I really hope that I presented our Russian-speaking colleagues from Russian-speaking channel. And now I'd like to let Erkin to tell us about the work he has done. And I'll be watching the chat regularly. So, Erkin, now it's your turn as a part of the team. The information on the collaboration between law enforcement and public health, please. It's now your turn. Erkin, please. Hello, everybody, the participants of our today's webinar. Briefly about me, I'm Iris Kulbekov Erkin. I'm a practicing mentor. I'm acting mentor of the civil society organization under the Soros Fund, was doing researches on Eastern Europe and Central Asia. As Elim mentioned, the research was aimed at the successful practices on the work of law enforcement and public health. Here, I would like to mention that researches have been done on certain priorities defined within the frameworks of the project, collaboration of law enforcement and public health in the area of mental health, HIV, drug use, family violence, and the situation connected with the epidemic, COVID-19. And now I'd like to demonstrate a little presentation. And tell you a little about the results of this research. First of all, the region. I already defined the region. It's Eastern Europe and Central Asia. Here, I would like to note that these countries inherited the system of law enforcement and public health from the former Soviet Union. Here, you should understand that these two different agencies, they have a different task, and on many issues, they can collaborate together. And some successful examples, as situation study analysis in the police work with a key group and public health, showed a different approach to collaboration in work and in solving different issues. That is, different countries on different issues are advanced a little more than other countries. I should note that some EUCA countries are already changing their attitude to the key group and are creating certain programs. For example, harm reduction programs, introducing decriminalization of drug use in their legislation. In other countries, the situation so far remains unchanged. The fine or any country can simply copy, take international experience or approaches, even evidence-based, and immediately implement it if the time is not right for it. But if we talk about the most basic elements of implementation at the country level, there is not only a strong political willingness, but there is also the willingness to implement this approach based on the specific evidences. There are some examples where is a negative or a side effect from the programs. Let's say people started using drugs more. The healthcare issues are included in the strategic and normative documents of the law enforcement system. For example, the concept on drug policy, counter social significant diseases, and so on. For example, the national program and municipal municipalities coordinate public health and law enforcement issues. They show a positive tendency on work of public law enforcement and public health. If we want to talk about successful programs, I would like to mention Kyrgyzstan and the program, the Synch Exchange program, which was first implemented in 1999. And today this program covers more regions. The program lets provide the drug users, injecting drug users with sterile injecting tools for the prevention of HIV infection and viral hepatitis. The exchange of syringes is done in drug treatment rooms of public health care institutions. The next program I'd like to mention about the methadone replacement maintenance therapy. This program was implemented not only in Kyrgyzstan, but also in Kazakhstan and Ukraine. The goal of this program is to stop or reduce the use of illegal opioids, reduce the harm and health risks from a certain method of the substance administration. For example, the risk of getting disease as a result of sharing the needles, and reduce the social consequences of drug addiction. The next program I would like to mention is a program in Kazakhstan. Unfortunately, this program was implemented in Kazakhstan in 2015 through 2019. Within the frames of this program, redirecting, we had there's many trainings on building the capacity of police and the civil society, of course, with the presentation of stakeholders of this project. Between civil society organization and the police, there were signed many agreements. In Moldova, the initiative aimed at building the capacity of the police to work with the key groups. Also, the program on redirection of people who use injecting drugs, sex workers, MSM, PLH, IV, and other key groups to services. So the program will run until 2022. This is what I wanted to say briefly about the results of my research. Thank you. Please, Elim. Thank you, Erkin, for this information. I think actually the huge work has been done on the part of in the area of researching many countries, in particular the former Soviet countries and now independent, but not all the countries, as you mentioned, have a positive experience. Not all the countries have parted with their old heritage. Actually, it's not ethical to compare that one country has been advancing and the other one is staying behind. So we would like to concentrate on the positive examples as a so we were far behind. to assess that one country works well and the other one not. So the practice is how to implement these good practices in the countries where they have not implemented before, to compare Kyrgyzstan with other countries. We can't. We know that there are countries that are located close to Afghanistan, which is the importer of drugs. So I think if our colleagues have some questions, I mean, the colleagues from a Russian channel and the English channel, please, you can ask your questions. Or you can ask Erkin or me. Before we can determine what we can do next. So, so we can turn to others. Please, we're waiting questions from the English-speaking channels. As we know, please, here, the first question from Melissa. It would be interesting to hear the examples of good partnership. And here's who, Vitaly raised the hand. Vitaly, you raised your hand, right? Okay. Then, go ahead and ask your question. Good day. I'm happy to be here. I'd like to start with a couple of comments that I have to the presentation. Coming from what have been said, I would like to say that methadone replacement therapy has been active. It started working since 2004. In 2005 in penitentiary facilities. And for 5 years, it was, as we say in Russian, it has been, we had extended access to this treatment all over our country. And I would like to say, if it's interesting for other countries, we have a program on harm reduction. I mean, syringe exchange in our Pridnestrovye region, and also in the Ukraine, and the second, the program which is supposed to run till 2022. I mean, the programs which usually work for 5 years. If you want to talk about the HIV program, so it's supposed to run from 2021 till 2025. Thank you. And if we want to talk about the Melissa's question, literally this year, we had a program which started working on harm reduction and collaboration between law enforcement in Moldova, and it's been done with the participation of the program in Moldova.
Спасибо, Виталий. Я
Thank you, Vitaly.
представлю тебя, потому что ты, значит, Виталий
I
является
introduced you.
координатором программы здравоохранения.
Vitaly is a coordinator of public health in Moldova.
С ним как раз таки являемся коллегами
We are colleagues.
по службе. Спасибо за очень ценные комментарии и уточнения, Виталий.
Thank
Я
you for your
просто,
comments.
какие-то вещи, которые имеют место быть в разных странах.
There are some things that take place in different countries, and within the frame of the work.
Поэтому какие-то то, что вы участвуете и уточняете, это очень полезно для нас, чтобы потом.
So the things you're trying to clarify, it's very important for us.
Я пока еще не вижу.
So far, I don't see hands. The question from Melissa.
Я отвечу.
Хорошо, хорошо.
I will answer.
Да,
Okay.
Мелисса, программа
Yes, Melissa,
снижения
the
вреда,
program
я
on
говорю щас
harm
о
reduction,
программах, обмен шприцами,
and I'm talking about the syringe
щас
exchange
внедряется
program.
на
They're
территории,
implemented on the territory
всей Республики Молдова.
of the whole Republic of Moldova.
Примерно 80% финансируется из
Approximately
глобального фонда,
8%
но
of
есть и
the
проекты,
global
которые
fund,
финансирует национальная касса
and there are also
страхования
funds
медицины. У нас в Молдове страховая медицина.
from the social medicine in our country.
Спасибо, Виталий. Но я также добавлю,
Thank you, Vitaly. I'd like to also add
программы
regarding the
замещения
extension
на самом деле
of the program,
уже сейчас внедрены.
a methadone replacement program.
То же самое у нас, в Молдове и так далее. Каждый раз мы испытываем,
Every
так
time
скажем,
we experience
трудности в ее расширении,
the difficulties on
риски,
expanding
что эта программа может
the
свернуть.
risks
Это прежде
that
всего
this program
влияние,
can be
нашего брата России,
canceled.
не имеет у себя в стране эту
It's a
программу,
program of our big brother Russia,
скажем, этот
which
подход, эту программу как
doesn't have this program
эффективной в
and
лечении
doesn't recognize this
наркотиков.
programs
Поэтому мы,
effective
будучи, например,
on treating.
Кыргызстан, будучи членом ЕАЭС, вы знаете, это экономический союз, Евразийский экономический союз, будучи членом, мы каждый раз
Eurasian Economic Union.
в законодательном регулировании, потому что идет унификация законодательного урегулирования вопросов наркопрофилактики и так далее. Поэтому
At the legislative level, every time
позицию, чтобы защищать эту программу,
we find out the position to protect this program, not only the harm reduction program, but
Поэтому мы всегда даже вынуждены работать над устойчивостью этих программ,
we are forced to work on sustainability of this program. And this program is mainly financed by the Global Fund. And then, and now it's supposed to be financed by the government. And here is a question on the legislative level. So for the English-speaking colleagues, this can seem strange. We, the countries of Central Asia and Eastern Europe, we keep up with this position. Maybe you, Gulzat, will tell us about the work you have done within the frames of the program on collaboration between law enforcement and public health, please. Yes, of course. Hello, everybody. We are working with law enforcement since 2006 in collaboration with the Soros Fund, Kyrgyzstan. And we started working with the police officers. We conducted training for them on the working with the key groups. The law enforcement groups have been trained, and they also trained their colleagues. Then we developed the first phase of instructions, working with the key groups on prevention of HIV. Then it was redeveloped for the second phase. And now on the second phase, we are working, which was developed in 2014. It's interagency work along with the Ministry of Public Health, Ministry of Internal Affairs. Together, we made up the instruction on how to work and how to engage with the key groups. These instructions, we have a plan made up for 2021. And now, according with this plan, we have been working. And what we did else? We're teaching. When we took the police officers to NGO, and they learned about the work with the NGO. There was also developed the program in Academy of Internal Affairs Ministry. The theory of practices on harm reduction. And the whole year they've been taught this program. The short courses, low-rank officers going through this program, through this training. We also, yes, we also do courses on harm reduction. What else I can say? With your permission, I would like to add, first of all, I'd like to mention the work of Public Fund, AIDS Foundation East West, for our English-speaking participants. And Gulzar works in the organization, in the international organization. It's found, and they are working on the setting up discussion between public health and law enforcement. And she's the only one who is carrying out this program and this work. Most of our colleagues actually been working on the is engaged in building a dialogue on the HIV program between law enforcement agencies. So I'd like to add more, but as I can see, there are more questions coming up. So the question from Melissa, she's asking, it would be good to hear the examples of collaboration between law enforcement and civil society on the issues on prevention of gender-based violence. And the second question, do you have any assessments on trainings with the police law enforcement? How do you find them? Do you find them effective? Gulzat, maybe you can answer. Regarding the gender-based issues, they've been included in the training, and the whole block was actually devoted to these issues. We evaluated even the last training, which was held in March in the city of Osh. We had 23 employees that have been taught and trained. We also had monitoring visits in some regions of our country. We have developed the instrument that, and this included the questions of police officials. We also have 38 questions and these questions on gender, on collaboration between key groups, and the last one, we had 3 evaluations on we had law enforcement officials and key population, the key group of population. And if we can want to look at 2016, we had violations from the law enforcement officials. We had about 75% of the whole amount. And the last research in 2018 showed that we had a reduction by 35%.
В течение 2 лет после проведенных тренингов, после проведенных мероприятий,
For the last 2 years, with events and programs we have done, showed that the reduction was by 35%. We also had a evaluation that
Документы,
thank you.
На сайте зарегистрированы отчеты.
All documents are registered on site, online. Elim, thank you, Gulzat, for your data. Detailed information, how you measure. And I would like to add a few words on training of police officials in many countries like Ukraine, Moldova, in Kyrgyzstan, and I guess in one more country. They have already implemented courses on harm reduction in law enforcement. And actually, the Soros Fund in these countries supported this program. program on sustainable development. And I think this good sustainable approach, implementing the courses in academy to teach future police officers on harm reduction, how to work with the NGO and key groups. And the next,
Хотел бы ответить
Ilim, I would like to answer
Мелиссы,
the Melissa's question regarding
практики работы
the practices
органов
of work
гражданским обществом
of law enforcement and civil society on
я хотел бы привести
issues of violence.
период эпидемии.
The period of epidemic, we all know, in March,
чрезвычайная ситуация, и сразу же где-то через 2-3 недели
we know there was emergency
положение и был
announced in our country, and
комендантский час.
then we had a curfew imposed in our country,
ограничено передвижение
and we had
в определенных
the population
территориях, и
was restricted to move, and
по фактам семейного насилия
we had
получается
reports on family violence,
их стало больше.
and
В связи с этим были созданы
these reports increased. We had mobile teams with this initiative. We had a civil society came up with this idea. We had a mobile teams formed from law enforcement officers, psychologists, and the representatives from non-governmental organizations, and they worked on the facts of family violence. So, and aided the victims on place. This is one of the examples which can be, which is one of positive examples. Thank you. Thank you, Erkin. Now I can see Vitaly links to the reports, organization Promalex in Moldova, and that actually related to prevention of HIV. Those who are interested can visit and get detailed information. So, I would like to there is maybe Sultanat can briefly tell us about her work, and we can show it as a good example. Whose students are becoming a policeman, who will share their knowledge with other police workers, police officials. Sultanat, please. Good day, dear colleagues, guests. Thank you for. I'm Sultanat Karaeva.
Действительно, наш вуз уже давно заинтересован был. Это в 2010 году курс медицинское право на сегодняшний день.
Our establishment was interested in the courses of, and I would like to mention that what our speakers told us earlier in thematical plan
Теоретическую часть для наших студентов степени бакалавра, которые готовятся по 4-летней программе. Обсуждался вопрос подготовки.
There was a issue discussed about the preparation for magister, and we reviewed this question and to leave this course for the legal course for. In our case, we just left the baccalaureate. And the question which was discussed with our colleagues, the tendency of the modern society to give fundamental theoretical knowledge. And today we can see there is a need. We have a possibility to teach our students, the foreign students and local students, and they will be interested within the frame of legal courses. We would like to introduce the new courses. That's for international students and in the international school. The legal courses with the elements of public health. In the future, we'll encounter as students the citizens of Kyrgyzstan. I hope they will get interested in the legal affairs. Thank you, Sultanat. I think it's clear how this course is implemented, and so we have a little time left, and I would like to get to the next question within this project and how we'll work at the regional level on improving the collaboration between law enforcement and public health. Indeed, I hope that each of you have their own vision, and we would like to share information on these issues and share information on positive and negative cases. It will be difficult to say right away what is in priority or not for you, and I hope we'll have a chance electronically receive all the information and use it as input for their research materials. So if you have any proposals, so I can see one more message. Melissa is writing. I just saw the documents. So there are no questions so far. I think there's a possibility for English-speaking channels to ask questions, to ask us questions it would be interesting for us to hear some additional information.
Керри, может, от вашего канала есть какие-то вопросы? Пожалуйста,
Kerry,
задавайте,
maybe from your channel,
чтобы мы
there are some
не
questions.
заполняли весь эфир.
So
Пока что не вижу
so I cannot see
или комментариев.
questions or comments.
Практически ни у кого сейчас говорит нету на
So
данном этапе, поэтому
no one has a
тогда
questions.
разрешите тогда сейчас вот относительно следующих шагов. Мы бы очень вас всех попросили с Эркином,
I would like to ask
дали
all of
ваши,
you
так скажем, предложения по следующему
to give us your proposals, your suggestions
шагам.
on
Первый
next steps.
Первый этап был это сбор информации.
The first phase was collect on information, what we have today. The next step will be what we can do, what we can contribute, what steps we can take. Can anyone share a positive experience on collaboration with the police? What characteristics can describe the policeman?
Или это от Мелиссы это прозвучало как предложение, чтобы люди
Or is this just a suggestion for Melissa?
это был вопрос.
Or it was a question?
Ну, мне кажется, Илим, здесь вопрос был адресован.
I think, Elim, it was addressed, this question was addressed to other participants.
Презентовал работу.
Она просит, чтобы кого-то
As I already presented my work,
тех людей, кто могли бы поделиться лучшей практикой, опытом позитивным.
so
при
she
взаимодействии с
addressed
полицией.
her question to those who could
Какие должны быть характеристики,
share their
кто
experience,
рассчитывает
good
полицейского
experience.
наилучшего, который сотрудничает с нами, например. Да, в следующих шагах нужно указывать кейс-стади,
On the next
которые вы
steps,
хотели бы исследовать. Следующий.
we would like to
Какие
mention
характеристики человека,
what
которые
characteristics
снижение вреда за взаимодействие с полицией. Вопрос всем. Ну,
on reduction,
давайте
harm reduction,
ответить на все эти вопросы. На самом деле, Мелисса,
working with the police.
мы на ваши
Actually, Melissa,
не успеем ответить с учетом того, что вы
we will not be able to answer all your
Во-вторых, это,
questions.
очень хорошо можно описать письменно, да?
And
Вот,
actually,
кто
you can
участвует у нас в этом коле, они могут дать нам письменно краткую вот эту информацию.
we can put it in writing. What characteristics of man who works with the police or the police who works with our programs, what is positive? I think we can put this on the paper then rather than talk about it. It will take a long time. I think it will be like a good direction for us. And the cases describe the next steps. The next steps can be the other cases which we can research, study. We cannot study all cases, but extension and expansion of all the aspects. We can write only if we receive these positive cases from our participants. So such plan we have, and the plan for next year together with Melissa and Kerry, we will discuss what we can include in our next step, in our next work. So
Может быть, у кого-то есть еще
our
моменты, которые
time is
могут
almost
быть. Если
up.
нет, то,
We have only 2 minutes.
скажем,
If you have any questions,
пожалуйста,
please, you can ask.
Полковник.
If not, so we can conclude.
Эркин, может, ты пару слов относительно работы,
Эркин.
следующих шагах и так далее.
Maybe you can add a few words regarding the next step.
Да, спасибо, Илин.
Thank you, Lynn.
Конечно, уважаемые
Of course,
участники,
dear
буду
participants,
ждать от вас, ваши
I'll be
идеи,
waiting from you,
предложения
your
по
ideas and
изучению,
suggestions,
вот, и
which I would like to include in my report
работы,
on improving
скажем,
the work
на предстоящий год. Вот. И,
for the future
почту
year,
я,
for the next year.
думаю, сейчас напишу в чате. Вот.
And
И также могу даже оставить
that's, I can
быстрой
type it
коммуникации.
in chat and I can leave my phone number for communication.
Благодарю вас всех, то, что вы смогли найти время и возможность принять
Thank you all for
Спасибо вам.
participating. Thank you.
Спасибо, Эркин. Тогда я
Thank
тоже
you,
со своей
Erkin.
стороны
Then,
выражаю благодарность.
from my part, I would like to also
Также
express
пишет,
gratitude.
Виталий, что последние 10 минут проблем с интернетом. Ну, Виталий, мы
I see Vitaly is writing.
коротко говорили о том, что
Нет,
Vitaly, we-
извини, не надо задерживать. Если были какие-то моменты,
хорошо.
обсудим с
Это,
тобой.
да,
Хорошо?
всё,
Всё,
понятно.
извини.
Спасибо. Тогда
Thank you.
всех благодарю.
Then,
Спасибо
thank
за
you all.
время выделенное.
Thank you all for your
Надеюсь,
time.
что у нас это не
I hope
последний звонок, у нас будет еще возможность
it's not our last
и дальше работать.
call and we'll
Спасибо.
have it.
А и вот как раз почту написал Эркин свой телефон.
Oh, okay. Erkin,
Всего доброго. До свидания.
Всем
Всем
пока.
спасибо.
thank you. Goodbye.